TA student that will be doing your exam today. If you could please remove your shirt, shoes, and socks and empty your bladder while I wash my hands, that'd be great. Wash my hands.
Are your hands?
Okay, so then as soon as your patient gets undressed, you're going to inspect for general health status, body habitus, physical deformities, and actually make sure you guys inspect them, otherwise you'll get points taken off. And then you're going to inspect their facial expression for signs of distress, stated age, parent age, good hygiene, and then levels of consciousnness by mini mental status exam. Then you're going to inspect the color of their skin, looking for any rashes, lesions, and masses. And you're going to palpate for temperature using the back of your hands, and as well for texture, and then for turgor, tenting for turgor. And then after that, you're going to do their temperature. So you're going to take your lovely thermometer. Make sure you put the shield over it, and you're going to ask the patient to hold this under their tongue. And then I'm going to start taking my patient's pulse for 30 seconds, multiplied by 2. Okay, 30 seconds has passed. And then you would stay here, and then I'm assessing his respiratory rate multiplied by 2 for 30 seconds. Beep, thermometer goes off, so you take the thermometer from the patient, you throw away the shield, and then I usually put most of my stuff away as I go so that it's put away, and I know I didn't forget anything. So after that, you move on to VP. Appropriate size of cuff, you guys have learned this, 40%, oh that's and 80%. So you're gonna do their blood pressure. I line mine up so I can see what I'm trying to look at, not where the marker is. 1 inch above the antecubital fossa. Health pulse systolic. Okay. And then you're gonna do their blood pressure. And for the health pulse systolic, you would say I would do this on one arm in each position, sitting, supine, and standing. Then you're going to go ahead and you're going to take their blood pressure. And then you would also say, I would do this bilaterally in both arms with them seated, supine, and standing, waiting the allotted 3 to 5 minutes in between each. So after you do their blood, oh, and then systolic blood pressure for the start, of course, cough signs, and then diastolic, the cessation, of course, cough signs. Then I move on to head and neck. I inspect the scalp for symmetry and contour. And then I inspect the scalp for any masses, rashes, lesions, nits, lice, something else, dandruff, hair growth pattern, texture of hair, and then contour of the scalp. One of the professors taught me to sweep your hands, because if you go like this, you might fall in all the sulci on their head, and then you don't get a full depiction of what their scalp feels like. So you want to make sure that you press your hands against the whole scalp to feel it all. So contour deformities, tenderness, masses, palpates for hair texture, and then I inspect their face for symmetry and parotid gland enlargement. At this point, I also inspect their lids, eyelashes, and eyebrows, and palpate the lacrimal apparatus as well. And then I palpate the face for tenderness, especially over the maxillary sinuses and frontal sinuses. And then if one was tender, I would transilluminate. Sometimes, Professor B, are you guys picking a sinus for them to transilluminate or not?
I think it varies, and you probably know, I just thought of this. I mean, she probably will know much better about how people would make use, because she probably had every single professor in school doing it. So it's nice for her to tell you what they like and what they don't.
Some of them will ask you to transilluminate and they'll pick one, so be prepared with your pen light. And then you're gonna test for sensation. You're gonna do light or pain. I always do light just because cotton balls are easier. You're gonna have them close their eyes. You're gonna do forehead, cheek, and chin, which would be your cranial nerve 5, sensory, ophthalmic, maxillary, and mandibular branches. Then you're going to palpate the temporal master muscles while the patient clenches their teeth. Go ahead and clench. Good. And then you're going to have them raise their eyebrows, close their eyes. Don't let me open them. Can you puff out your cheeks? Frown, smile, stick out your tongue. Perfect. And that's for cranial nerve 7. Then I go onto the eyes. I already inspected his lashes, eyebrows, and lids. Now I'm going to inspect his conjunctiva and sclera. Can you look up? Good. Next page. I already inspected and palpated his lacrimal apparatus. And now I'm going to measure visual acuity, near and far, cranial nerve 2 optic. You guys should tie a string on here for the exact length if you haven't yet. So can you tell me what line you can read with both eyes?
372 646.
Can you cover one eye? Read a line that you can read.
646 273.
And then I'd have him do it with the other eye. I'd do it near and far, and if they wear glasses, I would have them do it with their glasses on as well. That's cranial nerve 2 optic. Then I do his extraocular movements in 6 cardinal directions for 3, 4, 6, 4 trochlear, 6 abducences. Okay, follow my finger without moving your head. And then go far over for nystagmus, up, down, back to center. Cool. Then I do visual fields by confrontation, cranial nerve 2 optic. Cover your one eye and tell me when you can see my fingers. Okay, and then I would do the other side as well. Then I inspect his cornea. How does this pen light work? There we go. From the side, oblique lighting. I would do that bilaterally for both eyes. Then I do direct and consensual lighting, cranial nerve 2 optic and 3 ocular motor. I do this bilaterally as well. And then other. Okay. And then accommodative reflex 2 and 3. Can you stare off into the windows? And then look at my finger and follow my finger in. Good job. And then after that, I would do corneal blink reflex, which would be 5 and 7. Then I do ophthalmic exam, check the equipment for brightness. Then I would set it to proper setting. I would darken the room. Use the diopter to focus. You guys should already know what number you need based on your eyesight. And then using the proper hand-eye technique. So my right eye, my right arm, his right eye. Holding the forehead so I don't bump into his face. Did you have a question? Oh, okay. And then going in at an angle. Whoa, buddy, why doesn't your light work? There we go. Red reflex. Inspecting the veins and arteries. Following them to the optic disc. And can you look into the light? Good. And then I would do that bilaterally each side. Inspect the fovomacula. Okay. Speech and hearing and ears. So I'd perform the whisper test, cranial nerve 8 vestibular cochlear. So, okay, ready?
Baseball.
Good job. Do that bilaterally. And then I would do Reber and Renee for I need deficit noted. So, can you hear this on both sides?
Yeah.
Okay, good. And then the other one, tell me when you don't hear the noise anymore, okay?
No.
Good. So Weber and Renee, And then, I'm going to palpate and inspect his auricle tragus for any deformities and lesions. Do this on both sides. No pain. Then otoscopic exam. It'd be really nice if you have two of these, so they'd be set up all the time. But unfortunately, you don't. Okay. Turn on the light. And you're going to inspect their ear. Pull back the ear using your finger as fulcrum. Look into the ear and look for the tympanic membrane. Light reflex. Good. And I would do that bilaterally. And then that one.
That's weird.
Okay. I also inspected the condition of the tympanic membrane. Inspected the external canal. Now I'm going to palpate the nose and inspect the nose. No pain. Good. I'm going to ask my patient to tilt his head up so I can look in his nose. Do this on both sides. Okay. Looking for any polyps. Redness, deviated septum, and then eye test nasal patency and smells for cranial nerve 1. You don't have tissues in your bag either. Okay. Blow. Blow. Good job. And then can you close your eyes and plug what or occlude one nostril for me? And tell me what you smell.
Coffee.
Good. And then I would do this bilaterally. Cranial nerve 1, olfactory. Okay. Now. Alright, now I'm going to inspect his teeth, gums, oral mucosa, tongue, salivary glands and ducts, teeth, floor, roof, mouth. Did I miss something? I hear whispering. Okay, good. And then I'm going to have, I do my glove part first, then I can take them off. So after I do my pen. So open your mouth, stick out your tongue, say ah. That's cranial nerve 9 and 10, glossopharyngeal and vagus. So then I inspect the rest of his mouth, checking his gums, teeth, sides, roof, palate. And then I'm going to palpate his wardens and stents and ducts. Make sure you use the same hand for both. So stents, wardens, on both sides. Use pen line and tongue to capture. Okay, can you say 5, 7, 9, 10, 12 for me?
5, 7, 9, 10, 12.
Assessing voice and speech, 5, 7, 9, 10, 12, hypoglossal. I would perform the gag reflex, 9 and 10. Can you stick out your tongue and move it side to side? Cranial nerve 12. Okay, lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical chain, posterior cervical chain, and then can you lean? Perfect. Deep cervical chain, and I do those bilaterally, and then can you take a deep breath in? Supraclavicular, that's all those ones. Now I'm going to inspect my patient's anterior neck for masses and symmetry. I'm going to palpate the trachea, inspect the thyroid gland from the front. I'm going to move to the back of my patient and inspect from the back, have him swallow, isthmus, and the lobes of the butterfly. Yeah, lobes. And then doing the strength of the trapezius and sternocleidomastoid, push again my hand, push up, trapezius and sternocleidomastoid, cranial nerve 11. Now I'm going to do respiratory. So I'm going to inspect for respiratory distress, any accessory muscle movement. I'm going to inspect their chest from the side, anterior, posterior. I'm going to check for the AP diameter. And then I'm gonna check for any central cyanosis, peripheral cyanosis. At this point, so I don't forget, I also check for cap refill. Since I'm already at his fingers, and I do that on all 10 fingers, all 10 toes. Check for cyanosis on his toes, and clubbing and aspects. And then thoracic expansion, I always do mine on the back. So turn this way. And take a deep breath in and out. Good. And I do that on the front as well. You might just want to see that way because I got to listen to you. Now I palpate the thorax symmetrically, doing anterior, posterior, lateral.
Kevin, can you turn the other way so she can record your?
Oh, sorry. Too many cameras. Okay, and then the side. I'll do this side for you guys. And then the front. And then females, always tell them to displace themselves. Males, sorry, don't do it yourself. It will make a lot of people very uncomfortable. And that's the truth. And then I percuss, tactile front-of-the-disc. So I do this anterior, posterior, and lateral as well. Say 99. 99.
99.
Good. Sides.
99.
Front.
99.
Good. Now I'm gonna percuss his chest. So. Oh yeah, cross your arms through. Thanks. Okay, then I do the lateral side. And then I would do the anterior as well. Do the complete anterior as well, unless they tell you to defer. As long as they see you usually do it well on one side, they will defer you because it does take a long time. Then I measure diaphragmatic excursion. You don't have to do it. I have really. Okay. If I have a pen, is it okay if I write on you, sir? Okay. Always ask your patient if you can write on them. Don't just assume. Can you take a deep breath in and hold it? Okay, I would mark right here. And then exhale and relax for a minute. Give them a second to breathe. And then take one big inhale and exhale for me. Okay. I'd mark right here and then I would measure between the two lines, but this doesn't have a ruler. Okay, but you can measure, Dr. Paola teach you guys the finger thing. Measure the width of your fingers here. Perfect ruler, you always have it on you. Centimeters, always do that. I forgot what my number is. I'm bad.
Also, when you guys practice the skills that you don't feel comfortable doing, because that's where you waste most of your time. Most of you will have a trouble percussing, and because it's a skill that you have to perform a lot of times to learn how to do it. So practice that. You have to practice the order in which you're going to do head to toe, obviously, so you can save yourself some time. But if you're spending 10 minutes trying to find, the dolmas and the timpani, it will take you forever. So just practice the skill.
Okay, now I'm gonna auscultate breath sounds. I'm gonna listen for one whole cycle, inhale and expiration. I'm gonna have my patient breathe through their mouth. When I listen to your back, can you please cross your arms? Okay. So you guys can see, I'll do his front then too. Inhale. Always do it up in their collarbone too. Because your lungs go that high up, so don't forget that part. A lot of people can get them up back there. Then breath sounds are appropriate for the area auscultated. There's no rhonchi, crackles, or wheezes. If there's this suspected consolidation, I would do egophony, bronchoscopy, and whispered. What? Bronchophony, my bad. And whispered pectoriloquy. Which one would you like me to do, Professor B?
All three.
All three? Where is my consolidation?
Left lower.
left lower. Turn that one. Cross your arms, please. Egophony, please say E. Every time I move the stethoscope.
E, 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 E.
Always listen to the opposite side to make sure they don't sound the same. So the E would turn to an A. Bronchophony is 99.
99, 99, 99, 99, 99.
Whispered pectoriloquy, whisper 99. Yeah, that's good because I didn't hear anything. Okay, and then I'd listen to the other side. All three. Cardiovascular exam. Which side goes up? Okay. Have my patient lay at 30, 60 degrees supine. I inspect on the patient's right side.
Right, so that's the other thing. Make sure that when you're examining your patient that you are already standing on the right side. You still have to verbalize it, but.
It gets really confusing if you're on the wrong side.
So.
And you figure it out a little too late and then you have to restart.
And then again, you have to place the patient in that position. If you don't place the patient in that position, then the entire cardiovascular exam is gone. Nobody will give you a point. If he's sitting or if he's laying down for that portion of the exam, you're not getting any point for it.
That is a true. That is a true fact. Don't miss that. Inspect pericardium or precordium. Then I'm going to palpate the precordium with the ball of your hand. Don't miss this part either. People miss points because they put their fingers down. Aortic, pulmonic, tricuspid, and mitral. Identify the point of maximal impact. Impulse. My bad. Good. Now I'm going to auscultate aortic, pulmonic, tricuspid, and mitral with the diaphragm and bell, starting with the diaphragm. Bell. Now if I can have you roll onto your left side and you listen to the mitral and tricuspid with the patient in left lateral cube. Good, go ahead and lay back. Now I'm going to auscultate the carotid. Palpate carotids, one side each time, don't do both. You're gonna make your patient like go out, palpate them separately. Then I do all of their pulses. So brachial, radial, ulnar, femoral over their shorts. What else am I missing? Popliteal, would do this bilaterally. Posterior tib, do this bilaterally. Tibialis pedis, dorsalis pedis. 3 fingers. Dr. Anderson taught this because it's a loop. You'll be able to get the pulse better than if you just use 2 fingers, because your fingers will cover like the breadth of their foot. Really convenient trick that I learned. Now I'm gonna do, I did Cambrico. Now I'm gonna do their JVP. Turn your head to the left, please. Inspect for jugular venous pulse, 30 to 45 degree angle. You actually have to get down and look. And then you're gonna eye press down to make sure I don't feel any wave. Then, keeping your eye on the spot, you put your 1 ruler, and then you go this way. If I had a ruler, Kimberly, and you measure no more than 5 centimeters, is that right? 8 centimeters? I'd have to look. Then I auscultate his abdominal vessels, aortic, renal, iliac, and femoral over the shorts. and then at this point, I also do my palpation for abdominal aorta, so I don't forget. Start with your 3 fingers, down to 2. You wanna make sure it's no more than 3. Femoral, oh, pulse leg, radial and femoral pulse. Good. Do that bilaterally, I think. No, not bilaterally. Then, I'm going to have my patient sit up for me and move to the end of the bed. I'm going to have you take a deep breath in and then exhale and hold it while I listen to your heart. And exhale and lean forward. Okay, good. Checking for aortic regurg. And that's it for cardiac. Now you're gonna lay your head flat for your abdominal exam. You're gonna, please lay down. Supine position, knees flexed, arms at their sides. Xiphoid process to pubis symphysis. Inspect abdominal wall configuration. Then you're gonna auscultate first for bowel sounds in all 4 quadrants. Okay, after you auscultate, you're gonna percuss the abdomen. And for reference, you're not gonna get good percussion or auscultation if you only do 4. Make sure you cover the entire abdomen. And then percusses for liver span. This also, Dr. Pale had taught us, their liver span should be about the width of their fingers. So if you don't have a ruler like I don't, you can use the width of their hand. It's pretty cool. I didn't know that.
Make sure you have a ruler.
Yeah, don't try that on head to toe. That would be not acceptable. Mark you. Can I see your hands, please? Oh, look at that. Exactly what. Nice. And then you're gonna have your patient roll onto their side. Inhale. Exhale. Inhale. Exhale. First sleep. Okay, you can roll back onto your side. And now I am going to do light and deep palpation of the abdomen. Dr. Anderson also taught us this trick, is that if you do light and deep with both your hands layered, then it doesn't she says it doesn't intimidate patients because you don't suddenly place 2 hands and attack them, I guess, for lack of a better term. So this way they don't really notice that you're doing something different right off the bat until they feel you press a little harder. And then palpates the liver edge. I do mine differently probably than you guys were taught. So this way, the hook. Okay, take a deep breath in and exhale. One more time, inhale, exhale. Good. And then for the spleen, Dr. Paola also taught this. People's spleens can enlarge across their whole abdomen, so you want to start low. Inhale, exhale, and again. Good. Because if you only go right under their rib cage, you might completely miss it. Especially if they're coming in for mono or something, you might miss it. And then I already palpated his aorta for diameter. Kidney capture technique, bilateral. Deep breath, and out, and again, and out. That one. And then, palpate inguinal lymph nodes, over short, always short. And then, if you could sit up for me, then CVA tenderness, checking for any signs of pain for kidney stones. Perform rectal GU breast exam at this point as well. Okay, my favorite part. For every joint, I will be inspecting and palpating core symmetry, signs of inflammation, deformities, malalignment of bone, conditions of surrounding tissues, and each range of motion. Can you please stand up and face that way? Thank you. So I'm gonna inspect their spine, then I'm gonna palpate spinous processes all the way down, paravertebral musculature. Nice. Okay. I'm gonna have the patient turn around and face me. Okay. For cervical spine, touch your chin to your chest and up, and then shake your head now, and then touch your, and then other ear. Extension, flexion, lateral bending.
Make sure you verbalize those. So
Yeah.
you have to give clear instructions to the patient, but then you also have to explain the model.
Rotation. Last one. And then stabilize his hips. And I would have the patient bend forward, touch your toes, and lean back like you're doing back bend. Perfect. Can you bend down and touch one side this way? Another way? That's okay. And stand straight up. Can you look at me without rotating? Good. Good. And that would be extension, flexion, lateral bending, rotation of thoracic and lumbar spine.
Did you do your TMJs already?
No, I haven't gotten there yet. And then I inspect upper and lower extremity muscle mass and skeletal configuration. Don't miss this part. I missed it once and felt really stupid. And then I'm going to palpate TMJ. This is where I start to combine everything. So palpate TMJ. Can you open and close your mouth? Move your jaw side to side. Can you protrude and retract? Good. So during his TMJ range of motion, open, close, side to side, protrude, retract. Then I'm going to palpate his shoulders, checking all of the musculature and bony structure. Okay, ready? Range of motion, flexion, extension, adduction, abduction, internal rotation, or external, sorry, internal rotation. Good. And then, can you hold your arms by your side? Push out against me. That's shoulder abduction, C5 deltoids. Then I move on to his elbows, palpate the elbows, olecranon process, and then I'm going to have the patient do flexion, extension, pronation and supination. Good. And then can you curl your fists, your hands into fists, and then push up against me. Do elbow flexion, 5-6 biceps. Down, good. Elbow extension, 6, 7, 8 tries. Now I'm gonna palpate his wrists, fingers, and now I'm gonna do wrist flexion, extension, ulnar, radial deviation. Now can you push, keep your fingers curled, push up, good, and push down. So I'm doing wrist flexion, 6, 7, 8, or 6, 7, I'm sorry. Wrist extension, 6, 7, 8. Now I'm gonna do fingers. Can you curl your fingers and fall out like this, together, out, thumbs in, and then opposition. So flexion, extension, abduction, adduction, opposition of fingers. And then I'm gonna do hand grip. Can you squeeze my fingers? Pull. Good. Hand grip, C7, 8, 2, 1. Can you spread your fingers? Don't let them pull together. That'd be finger abduction, C8, T1, ulnar nerve. Hand grip I did. Opposition. Pull. Again. Good. Again. Good. Opposition is C8, T1, median nerve. Look at that. Okay, now I do hips, palpate their hips, and I do hip extension differently. Your elderly, you can't put on a bed and hang their leg off. So I hold their hip, yep, have them step backwards, and then the other leg, nope, just step backwards. Extension, good for hip. Now, can you please lay down for me? So that's your hip extension, palpating the hip. All right, straighten out your leg, please. Make sure you stabilize their opposite leg, and you're gonna go adduction, abduction, and then both your rotations, external, internal, and then flexion of hip, flexion of knee, extension of your knee. Then you're going to palpate the knee, because you already did the range motion. Palpate the ankles, do all of this bilaterally, palpate the toes. Dorsiflexion, plantar flexion, inversion, eversion, curl your toes, flexion, extension, push them out. Okay, can you go ahead and sit up for me facing your direction. Good. Push up against my hands. Hip flexion, L2, 3, 4, iliopsoas. Adduction, push in, L2, 3, 4, adductors, out. Abduction, 4, 5, S1, glute med, min. Pull down, push down. This one's like hard to do, but. Hip extension, S1, glute max. Stand to the side so you don't get kicked. Knee extension, L2, 3, 4, quads. Knee flexion, pull back, L4, 5, S1, hamstrings. Push your toes to your nose. Tib anterior. And that is L4, L5. Plantar flexion, push down on gas pedal. S1 gas shock, good. And then extension of great toe on both sides. That's L5, extensor hallucis longus. Now, I do sensory. C5, anterior arm. C6, lower forearm, thumb. C7, pointer and middle finger. C8, ring and pinky finger. T4, nip line. T10, umbilicus. L1, L1 inguinal area, sorry. L2, anterior upper leg. L3, medial over to knee. L4 is medial calf. L5 is lateral calf over to big toe. And S1 is lateral foot, sole foot. Then you do joint position sense. I do this on all 10 fingers, all 10 toes in vibratory sense. Starting with vibratory. Tell me when you no longer feel this. Close your eyes. Ooh, sorry, you don't want to hold their hand, my bad. You didn't tell me to stop. Ready?
Yeah. Stop.
Good. And if they don't get it, then move up their arm proximally. Then position sense. Gonna move your finger up and down. Tell me which way I'm moving your hand, okay? Grab it by the side.
Up, down, up, down.
Good job. Now I do, for your discrimination test, I do grasthesia and extinction. Tell me what I'm writing in your hand.
8, 7,
4. Nice try. All right, close your eyes. Extinction. Good. Then I do reflexes. So biceps is 6, 7. Good. Then can you make muscle right here? Good. Relax. I'm not good at this. You're like, why won't you twitch? Oh, okay, got it a little bit. Okay, relax your elbow. Triceps. Oh, brachioradialis biceps. Triceps, I showed some of you this. Feel for the tendon first. Good. And that's 6, 7. Patellar. Feel for the tendon. L2, 3, 4. Achilles is S1. Good. This one's my favorite because it drives people nuts. Plantar. Really? There we go. L5, S1. Ankle clonus. No bounce. Good. Can you run your heel down your shins? Good. Coordination. Okay, can you stand up for me? With your eyes closed. Can you hold your arms out for me? And don't let me push them down. Romberg, good. And checking pronator drift. Okay, can you walk towards me? Heel to toe.